Hi. Hi, it's Jacqueline Harris. I'm going to jump straight in talking tonight about thyroid health and how this might be impacting your fertility. Actually, how it might be impacting your health, but of course, that can obviously have an impact on your fertility if your body overall is not as healthy as it can be. So, for those new people joining me, let me introduce myself. I'm a naturopath and I'm a natural fertility expert. I've been specializing in fertility health since 2005, and I'm incredibly passionate about it. My own beautiful children have been created with the technology of IVF, and I think that a big part of me coping emotionally, mentally, and also it helping me to produce my 3 healthy children was the work that I was able to do by taking care of my own body and the tools that I use to actually help myself and my husband be as healthy as I can. So I'm on a mission to help other women, but of course couples, create the baby that they dream of, the positive pregnancy, and really importantly, my ultimate aim is to help women have the life that they want. So tonight's topic is really big, and I feel like I've got to be quite cautious with it because there's a lot of content that I would share with people in clinic when I can have an open discussion with them, and one when I'm very clear about their test results, working with their doctor and what we're actually going to be actively working on. And just talking very generally about this, I feel like I need to be safe and make sure that the information that I give you it's going to have to be a little bit broad because there's just so many different possibilities with this. And it is such a big topic that I think I'm going to start with tonight just giving you some loose information about this and a couple of steps because I always want you to feel like you've got some takeaways to work with. But I think that we'll probably do this over a few parts and break it down. Some of the more detailed ways that you can actually support your thyroid and what might be having an impact on it. I think maybe you can break that down and talk about that a little bit deeply in another video. So if you have any questions, and I've already had some questions sent through, if you have any other questions, make sure you pop them in the comments either live with me now, or if you're watching this as a replay, by all means go ahead and pop a comment in or a question in and I can come back and answer that to you just by typing it out to you. So I'm going to get right into it because otherwise I'm never going to get all this information out that I want to share tonight. So let me go back to the very beginning, assuming that you may know what your thyroid is, but I'm just going to start from scratch. So your thyroid is a little butterfly-shaped gland here in your neck, sort of just behind your voice box. And it's responsible for the production of your thyroid hormones, most specifically T4 and T3. Now, there's a feedback mechanism that helps in the production of these hormones. And I'm going to keep this very simple because I don't know how much knowledge you have, but I want you to know the very basics to begin with. So there's a feedback mechanism where there's a message that gets sent from your brain, which is thyroid stimulating hormone. If you've had some blood tests done, that would be written as TSH. So your pituitary sends out TSH, thyroid stimulating hormone, to stimulate your thyroid to work and produce your thyroid hormones. Now the feedback mechanism goes like this. If your body recognizes that there is enough of the thyroid hormones, T4, T3, then the thyroid stimulating hormone might pull back slightly. If your body recognizes that you need more of these thyroid hormones, it is going to send out more of the thyroid stimulating hormone, higher levels of TSH, to try and stimulate more production of T4 and T3. Now, T4 and T3 are, there's other thyroid hormones actually, but they're the 2 main hormones that we have in our body. And we have more T4, but it's not as active as T3, which we have smaller amounts of, but it's the most active form of the hormone. T4, interestingly, actually gets converted into T3, and there's numerous nutrients that are very important for that conversion. Including we need zinc and we need selenium. Tyrosine is really important as well. So there's a lot of nutrients that are involved in the conversion of those hormones, and iodine is a really important nutrient for the production of the thyroid hormones to begin with. So you can see that there's this interplay between what your brain and your body is producing along with the nutrients that you're getting in your diet. So it is a very interplay of different things that are having an impact on your thyroid hormones and on your thyroid hormone production. Let me just see. I'm going to go through a few things. I've just got a few notes that I wanted to mention along with this because there's just so much information I could give you about how it's produced and how it actually works. T4 can actually be produced into a more an active form of T3. And I'm just going to very loosely mention there that can happen at a time when your body's more likely under stress. This is a bit of a protective mechanism that our body has in place, but that can potentially impact your thyroid readings, your T4 and your T3 readings, when you might not see a great reading of T3, and that might be because your body's producing some of the inactive form. So there is the possibility for that to happen. The other just really important thing that I want to mention here is that there's a really big interplay with your thyroid, your adrenals, and your reproductive hormones, which is why thyroid health is so very important for your fertility. So you can't actually, it's very hard to separate these ones out completely. And it's unusual to see, say, for example, thyroid hormone problem in isolation without there being any impact on the adrenals or any impact on the reproductive hormones. Conversely, also the other way around, it's very unusual to see someone having issues with their adrenal glands and not see any impact on the thyroid. It's possible, but there's usually some interplay between these together. The common issues that I might see with thyroid and specifically reproductive hormones would be perhaps some issues in the production of progesterone, or might be more the tendency towards estrogen dominance. I can't go into all of these issues with you tonight, but I'm just wanting to mention some of these so that if this has been discussed with your doctor, with your naturopath, with your fertility specialist somewhere along the way already, it might be triggering an aha moment for you where you're like, okay, so I have been identified of having estrogen dominance. Maybe my thyroid is a key player in that. Or if you have been diagnosed or identified as having some sort of thyroid issue, you may now understand why it's more likely that your progesterone levels might not be so good. Or why you might also be identified as having some level of adrenal stress or adrenal fatigue, because they're all very tightly interlinked. Let me go back a step completely and talk about what your thyroid's actually doing. It's basically responsible for, if I can say it, everything to do with your metabolism, which I think a lot of people think or associate it as being things like weight, how fast or how slow you put on weight. And that is one factor that our metabolism has on our body. So if you have a slower or a lower thyroid function, it's possible you might find it harder to lose weight. Or if you have a high thyroid function, if it's too high, you might find that you're losing weight without knowing why it's actually happening. That's just one possible trigger that it might have. It's basically, if it's high, it's affecting every aspect of your metabolism. So that might be how fast your hair falls out, how fast your eyebrows fall out. It might impact how fast your heart heartbeat rate goes, or it might impact upon the temperature that you feel. You might feel quite hot or have a sensitivity to the heat if everything's working quite fast. On the flip side, if everything's working quite slowly, it might be that you feel cold a lot of the time. Your skin and your hair might be dry and brittle. You might have really slow bowel function or have issues with constipation. So it's basically everything in your body is kind of working a little bit slower, or everything could be working quite fast. So it really can have a very big impact on the way you feel in your body overall, which is why when someone has thyroid disease, such as Graves' disease, which is a really overactive thyroid, or Hashimoto's, which is an underactive thyroid, they can have considerable symptoms, and quite often symptoms that are really impacting upon their daily function, someone's daily function. But You can also have a thyroid that will be fine. It will come up okay on blood tests. Your doctor might say it looks fine, but you might not feel quite fine, as in you might be finding you've got more symptoms of a slower thyroid, like constipation. You might be finding a little bit harder to lose weight. If we do your basal temperature, you might find that slightly lower. Or it could be that your periods are off, or that you've got symptoms of estrogen dominance, heavy periods, clotted periods, that kind of thing. Put all that information together, and it is possible that you have a suboptimal thyroid function, which is where it might look fine on your blood tests. It might be within normal reference ranges, but it kind of matches up and that they're not quite right. A useful piece of this puzzle for me is when I look at the blood tests. And if you've been following along with me for a while, you know that I look at all the blood tests from optimal reference ranges. Where, so your doctor's making sure there's nothing wrong, which is really important. They're going to make sure that, if they say when they're looking at your thyroid test, they're making sure you don't have a hyper or a hypothyroid, which means an overactive or an underactive thyroid. We want to make sure that it's not that case. But when I look at them, I'm looking at the reference ranges slightly different and making sure, or whether I'm looking to see whether your levels are within optimal. Are they as good as what they can be? So do your blood levels look perfect or ideal? And is your body telling us that your thyroid's functioning really well? And that, I guess, is a little bit of the difference when I'm considering whether or not I think thyroid might be playing a role in somebody's fertility equation, is whether or not the body is giving us information that the thyroid might potentially be an issue, along with potentially what I'm seeing with their basal body temperature and their blood tests. So if the blood tests look slightly less than optimal and the temperature's lower than optimal, and there's a few symptoms of a slightly sluggish thyroid, put all that together and I'm probably thinking this might be a piece of the puzzle that we need to address. And not only do I find when I work with that someone can feel significantly better in their health, in themselves, mentally and physically. I've definitely seen times when we've focused that as a part of our treatment and we've seen that positive pregnancy test come up. So I guess that's the bit of a difference in the way that I'm looking at it. If you have been diagnosed with hyperthyroidism, hypothyroidism by your doctor, so Hashimoto's or Graves' disease, and those levels are not within a normal reference range, then certainly your doctor or endocrinologist is probably discussing with you that this is having an impact on your thyroid. Certainly if you've got really high levels of thyroid hormone in your body, they're probably advising you don't even try for a pregnancy until they get that stabilized. So we know doctors will definitely work on it if they see it outside of the normal reference range. The difference that I find in the work that I do is that when things are even within normal but not quite optimal, and I start to work on that, that's when I can see that's the difference that I would be focusing on as opposed to your doctor or your endocrinologist in what we're looking at in terms of thyroid function. Now, I really work alongside people's doctors with this. If someone has a case of thyroid disease and it's not well managed, while many naturopaths are confident or may be confident to work on it on its own, I will really want to be working in coordination with someone's doctor and their endocrinologist until we get things stabilized and within normal reference ranges. Because one part of that puzzle is that we need to be having regular blood tests, and also I'm just wanting to make sure that I'm keeping that person as safe and as healthy as I possibly can. And I really like to work with people's doctors and endocrinologists. It's a working team. If they give me the advice that they do not want their patient to be taking X, Y, or Z, I will definitely not prescribe those things. If they're open to them working very much on the dietary side of things that I'm working on, and there's a few supplements that they're happy for me to prescribe and work with, then I'm happy to work within those realms as well. If a doctor or endocrinologist is not seeing any problem, they're really happy with how the levels look, they're not concerned at all, they think that there's no issues in terms of thyroid function, then I'll still often work with that in terms of trying to get their body as healthy as it can be, because that is very important for someone's fertility. Now, a question came through which was, what if you've got, say, you've had your whole thyroid removed, maybe the case of thyroid cancer or for any other reason, and so a total thyroidectomy, and is that going to be having an impact on fertility? First off, I need to work out what's actually going on with that person. Say, for example, I haven't really touched on this yet, but let's just say it was their immune system that had been attacking the thyroid, and that's why a thyroidectomy had been performed. If those antibodies were still elevated, even though the thyroid levels looked on blood tests to be okay, if there was still any sort of antibodies in the body, then I still think that could be having an impact on fertility, and I've seen that the case. We do know with high levels of antibodies that there can be an increased risk of miscarriage, and we do want to work on not just getting pregnant but also maintaining a healthy pregnancy. So yeah, if the thyroid's been removed but there's still any sort of autoantibodies in the body, then we do need to factor that into the fertility puzzle. If someone has, say, had it removed for the sake of a really big cyst or a thyroid cancer, and their blood work looks great, and their body is telling them the levels that are being fed back through the drugs that they're taking are okay, so the body is saying that this feels fine for them, no symptoms of either hyper or hypo, then I don't necessarily think that we can say that every time that's going to be having an impact on fertility. It would very much be case by case. But if I had a patient that I was working with and their levels looked good in the blood work and their body was giving them no symptoms of a hyper or hypo, even with the thyroid completely gone, as in the medications that they're taking are completely controlling their thyroid, keeping their thyroid levels looking really good, then I think that that's okay. I wouldn't be majorly concerned. The only thing that I will say with that is that life, obviously we're not living in a bubble, and so that even if the blood tests look really good at one particular time, I would still be wanting to make sure that through the person's fertility journey that their blood work was being analysed regularly, their temperatures are being monitored, and we're monitoring for any other symptoms of either slightly hyper or slightly hypothyroid, because we know that, for example, stress can have an impact on what your body's doing with those thyroid hormones. We know that the adrenal function can impact upon what's happening with those, the conversion of the thyroid hormones. So if, for example, the blood work looked great, I'm still talking about the case where someone's thyroid's been removed. If that blood work looked great, and then say 3-6 months down the track, you're still trying to conceive, but there's been a huge amount of stress, maybe work, maybe family, maybe moving house, whatever the stress, maybe it's fertility causing the stress, then I would reevaluate that blood work again, along with their symptoms and their body temperatures, to make sure that those thyroid levels were still looking as good as it could possibly be. I've briefly touched on the autoimmune side of things. Sorry, I'm jumping back now. The immune side of things is definitely a very important piece of the puzzle, so much so that I almost think that I do think I've written this down as a topic that I'm going to cover in one of the future videos in the next couple of weeks. Because if you have autoimmune disease of any sort, particularly thyroid or including thyroid, we do need to make sure we're actually addressing the immune side of it, not just the thyroid levels, but the immune and the antibody part of it. So if you know you have thyroid antibodies, hold tight, because you'll see some more information about me about that from me in the coming weeks. We need to work specifically on those to help improve your thyroid levels. But the rest of the information that I'm going to go through shortly with you is in a few steps that I think you can begin to work with on for your thyroid. They're still relevant for you, but if you have those antibodies, we also need to make sure that we're working on that or for that as well. I hope this very loose description about thyroid has helped in some way. Like I said, there's just so much detail that I could go into about how your thyroid's working and what it's controlling, but it's very hard for me to be too specific about it when I'm trying to speak very generally to all of you rather than one-on-one with a patient. So if you have very specific questions about your thyroid function and how that might be impacting your fertility, I really encourage you to reach out to me, and we can do either an online or a face-to-face consultation if you're in Launceston near me. Otherwise, we can do it online. Or if not me, another natural fertility expert that you feel confident in, to really have your thyroid thoroughly investigated. And that would be in conjunction with your doctor. Like I said, I really love working along medical professionals. My clinical practice is alongside an obstetrics and gynecology team. I share their offices, and I know and respect the work that they're doing in terms of their investigations. I know my limits in terms of the tests that they will and they won't want to request or investigate. So just make sure you're working with a holistic team. I think that's really important. So if you have very specific questions, please make sure you're reaching out and asking for some, getting some help for this. Now, like I said, I always like to give you some information to take away, and I could talk a lot more about the actual thyroid, the physiology and the anatomy, but I know mostly importantly you want to actually know what you can do for this. And again, there's just so many steps that I would work with this in clinic, and I cannot possibly go into that much information with you in this video. So I am just wanting to share some of these steps. Please do not think this is everything that you can do or everything that you need to look at, but this is the beginning. So my 3 steps tonight: assess, stress, digest. These are the 3 things that we're going to look at. Now, the assessment part is a part that I've spoken to about numerous times. I've already mentioned it tonight. That's making sure you're assessing your levels from optimal reference ranges. So we need to make sure we assess the thyroid stimulating hormone, the TSH, and look at that and put together also the information that we see from your T3 and your T4 readings. All of that information helps to give us a really clear puzzle. Now, here in Australia, with the way a lot of people have their blood tests done, which is basically just through Medicare, they will have their TSH levels checked first. And if that reading comes back fine, the one from the pituitary, Medicare will not go ahead and test the T3 and the T4 readings. If I can get those, and if a doctor's happy to do that, I love to see the 3 of them together. If I cannot, if I only have the TSH readings, it's still useful. It still gives me good information, but we definitely want to make sure we're looking at it from optimal. And I also want to put that TSH reading together with what your body is telling me. So what symptoms do you have and how do you feel? And I also want to see your basal body temperatures. Now, generally, I do this for every fertility patient throughout their whole month, every single day. But if for some reason we're not going to be doing those temperatures through the whole cycle, then I will at least do them from day 1 to 5. Now, this is also important for male factor fertility. A male's fertility is definitely also impacted upon by his thyroid function. And so and this can have an impact on testosterone, if I'm only seeing his TSH reading, we have no other information about T3 and T4, I do want to see 5 to 7 temperatures in a row as well, because that information together with the TSH and how his body is feeling can help to give me more information about his overall thyroid function. If a doctor's happy to get the information and ask for TSH, T3 and T4, then that's my preference. I can request those tests for patients, and some of my patients do prefer just to pay out of pocket for all 3 and have those investigations done. Others prefer to see what they can get through our health system here, like I said, through Medicare. Along with looking at all of those 3 tests and whether they're in optimal reference ranges, I often request the thyroid antibodies as well. It's not often a test that I request straight off unless I've seen already recurrent miscarriages in someone's history when they first come and see me, or if they've already had a family history of thyroid problems, or their own thyroid has had some unusual results. If I haven't seen any of those, then I might just request TSH, T3, T4 to begin with. But if there's any of those other things going on, then oftentimes I might see if someone's doctor's happy to request the thyroid antibodies as well. And when I can justify and explain to someone's physician why I'm wanting to see those investigations with significant justification to back it up, and like I said, I understand why they may or may not be able to request them. If we have an open relationship about that, it's not very difficult to get them. That's why I said I don't just request them for every single patient that comes through the door. One, because I know that not every doctor is going to want to write them up if there's no justification. It puts people in an uncomfortable position. I know what it's like to be the patient and going in and asking your doctor, look, I've had a discussion and we're wondering if we can do these blood tests. If you can't justify to your doctor why we think that you'd like to have them, it's very, very uncomfortable. And so I think that, like I said, I'm very mindful about knowing why you will or will not want to request blood tests. But with any of those tests, TSH, T3, T4, thyroid antibodies, we do want to make sure that they're being looked at from optimal reference ranges, not just from the normal reference ranges. And like I said, I'm very happy to work with you for that, or otherwise find another holistic practitioner or integrative doctor who's happy to look at those for you from that perspective as well. So that's my first step, assess. The second step is stress. And by that, I mean address any stress. Like I said, this is not an exhaustive list of the things that you can do for your thyroid, but some of the things that I think you need to begin with. Stress can have a direct impact on whether or not your body is going to convert T4 into an active form of T3 or whether it's going to convert it into an inactive form of T3. I already mentioned this earlier. I hope I haven't lost you with that. But if you are going through significant stress, physically, emotionally, or mentally, that may be impacting upon whether or not your body is converting into active T3. Your T4 levels might look great, your TSH levels might look fine-ish, but your T3 levels might not look ideal. And this could be because you've got the inactive form of T3. Or the levels might look okay, but we're not actually, you don't feel that. You don't feel like your thyroid level, like we've got all these symptoms of an underactive thyroid, but the levels might look okay. And that might be because it's in an inactive form. Now, working with stress is very wide and very varied. There are numerous things that you can do to help with the stress response in your body. Ideally, the very best thing is to work on whatever is triggering the stress. When you're trying to conceive, I know that the stress can sometimes come because you are trying to conceive. And so if I could suggest just one thing to you right now to work on for the next week, is we'll be making sure you have a really good quality of sleep. If you cannot change what's happening in your life right now, we need to change your ability to adapt and cope with that. And I think what I see in clinic a lot is that people are not having a good quality of sleep or enough sleep. People are not prioritizing this as one of the most simple ways to actually help you deal emotionally, physically, and mentally with stress. So a lot of people tell me they feel like they can't go to bed early. My advice might be that you literally go to bed, depending on your routine. It might be that you go to bed at 8:30 for 3 or 4 nights in the next week. It might be that you focus on the quality of sleep. Perhaps you are in bed for long enough, but you're really restless, or your mind is playing a lot of games. Then make sure you're actually trying to work on that stress response and work on the quality of your sleep. Again, I can't go into all the details with you tonight. It's something that I work very thoroughly with a lot of people in clinic. So it is something that I deal with on a daily basis. But I want you to begin to work on it, whatever that might be. Like I said, it might just be going to bed earlier. Just make sure you're having a better quality or a longer sleep so that your body can cope better with the stress that you might be having in your life, because that's very important for your thyroid function. So that's the stress section that I think you can begin to work for your thyroid health. The third thing that I think you can work on for your thyroid health is digest. And while, yes, your digestion is very important, and I guess I'll probably cover that in another video specifically about more likely with autoimmune. I think that's a really important link there. But when I mention digest to you tonight, I actually mean the nutrients that you're getting in your diet. I want to make sure that you're getting them, you're eating them, and I want to make sure that you're absorbing them. Now, there's very specific minerals and amino acids that are very beneficial for your thyroid function. A lot of them you will have heard of. And I can't even be broad enough tonight to tell you that you need to go and get all of these, because it's not that simple. We need to work out which ones you need, which doses you need, and what's safe for you. But the important nutrients for thyroid function include iodine, but I need to be very careful. You need to be very mindful of this. If you have an overactive thyroid, if it's on the higher side, iodine might be the exact opposite of what you need. So it might be what you need, but it might be the exact opposite. So I don't want you to race out all of a sudden and get an iodine supplement, but just we need to work out whether or not iodine is something that you need. There's tyrosine, which is an amino acid. You've got selenium, which is a very important mineral to help in your thyroid hormones. Vitamin D plays a very important role in your thyroid function and thyroid health. Magnesium and calcium at one level, at one step of the equation in how your thyroid hormones are produced. Magnesium and calcium are very important. And the other important mineral is zinc. And I feel like I can be a little bit looser with this one because most people can benefit from extra zinc in their diet. So you might go out and get yourself a zinc supplement. If nothing, it's going to be very good for your immune system anyway. But zinc is one that you can easily work on through your diet, particularly if you eat animal products. It is one that you can focus on boosting in your diet. So you can get it easily through eggs, specifically the yolk, but also through some seafood like oysters. But a lot of animal meats are very high in zinc. You can also get it through foods such as brewer's yeast, through liver. If you're eating liver, you can get it through legumes. The little green pumpkin seeds, pepitas, are also rich in zinc. My power's just gone off, so I'm not sure if Wi-Fi has continued or not. It looks like it's come back on again. I'm not sure if you've caught that last part or not because the power just went off here. But zinc is, I think I was just talking about the little green pumpkin seeds, pepitas. That's an easy way for you to add them back into your diet as well. So that's a very easy one for me to be able to say add into your diet without, now everything's starting up, my printer's making noises. That's a very easy one for me to be able to tell you to introduce in your diet without there being any real reasons for any concerns or any reasons for you not to take it. But it is really important, like I said, for you to investigate with your nutritionist, naturopath, holistic practitioner, integrative doctor, which of those nutrients might be beneficial for you with your thyroid function. And those 3 steps are the ones that I want to leave you with tonight as things that I think you can begin to focus on right now. First off, assessing your thyroid function, figuring out if this is having an impact for you on your fertility. The second one is making sure you are addressing stress, because stress can directly impact whether or not you're producing active or inactive thyroid hormones. And the third thing is making sure you're addressing any nutrient levels by looking at your digestion. Are you eating them? And are you absorbing those nutrients that are really important for your thyroid function? I hope this information is really useful for you tonight, because this is one of these areas of health that I think we need to be really cautious about, and it's so important for fertility. It really is one of the tick boxes that I cover with every single patient that I see, whether or not their fertility might be having an impact on their fertility. I do need to make sure that you are having this. I do think you need to have it thoroughly investigated with someone. I don't think this is one of these things that I do not think you try and treat your thyroid function by yourself. Stress management, I think you can do that, some of that by yourself. I think you can work on introducing some of those foods into your diet by yourself, but actually treating your thyroid function by yourself is not something that I suggest you do. So reach out to me if you're looking for an appointment in clinic, and I'm very happy to get you booked in and have a thorough investigation of both your thyroid function, and your fertility. If you've got any questions or comments as you watch this back, please put them in, because I'll pop back in and check through there. And I look forward to checking in with you in future weeks ahead now with some other factors and other influences on your thyroid function and your fertility, and how the two are very tightly interlinked. Bye guys.